Hey guys, before I do my episode today, I did an episode a little while ago about TIP, or the Transition Integrity Project, and I buried it in a longer episode. Long story short, this Transition Integrity Project is like the Event 201 for CV. It is the blueprint, the roadmap. It is what they're planning on doing. I'm going to show you a couple of videos, and I'm going to be right back.
I don't think that there should be any debates. I do not think that the President of the United States has comported himself in a way that anybody should, and that has any association with truth, evidence, data, and facts. I wouldn't legitimize a conversation with him, nor a debate in terms of the presidency of the United States.
Hillary Clinton said in a new interview that Democratic presidential nominee Joe Biden, quote, should not concede under any circumstances because she believes the final results in November's election are going to drag out due to mail-in voting. Clinton told former aide Jennifer Palmieri on Showtime's The Circus, quote, Joe Biden should not concede under any circumstances because I think this is going to drag out. And eventually, I do believe he will win if we don't give an inch and if we are as focused and relentless as the other side is.
So both Pelosi delegitimizing Trump and saying that she would not legitimize him it's straight out of the TIP playbook. The assault on Trump via the post office is straight out of this playbook. And Hillary Clinton coming out and saying that she would not concede to Trump under any circumstances, again, is straight out of this playbook. Not enough people in the truther community have read this TIP report. This link will be in the comments below. If you can please, I don't care who you know, but if there are truther channels out there that you know that you can get this information to, take the link and spread it. Share it to people, as many people as you can, because I'm telling you right now, you can read this report and you can see how things are going to go. And you know exactly why Hillary Clinton now is saying she would not concede no matter what to Donald Trump. They are counting on violence in the streets and a military intervention in 3 out of the 4 simulations they ran in this report. And they say it's bipartisan, but it's not. It's bipartisan as in it's Democrats and never Trumpers that got together and ran this simulation. It's a war game. And it's exactly what their playbook will be. In the time period from November, after the election, to January before Inauguration Day. That is what they're planning for now when Hillary Clinton says, I would not concede under any circumstances. I think throughout the past week or so, my opinion on the Department of Justice has been made pretty clear concerning my episodes on the Kleinsmith charges and the possibility that there may not be any more charges, or if there are, it will only be that Soma character. I am a little bit in the doldrums about the DOJ at this point, along with everything else, but I did see that the DOJ made this announcement today, and it's also something that I've been covering and I've been extremely worried about. So I want to just cover this as news, and then that'll be it for today. For immediate release Wednesday, August 22nd, 2020, Department of Justice requesting data from governors of states that issued COVID-19 orders that may have resulted in deaths of elderly nursing home residents. Data will help inform whether the Department of Justice will initiate investigations under the Civil Rights of Institutionalized Persons Act regarding New York, New Jersey, Pennsylvania, and Michigan's response to COVID-19 in public nursing homes. Today, the Justice Department requested COVID-19 data from the governors of states that issued orders which may have resulted in the deaths of thousands of elderly nursing home residents. New York, New Jersey, Pennsylvania, and Michigan require nursing homes to admit COVID-19 patients in their vulnerable populations, often without adequate testing. For example, on March 25, 2020, New York ordered, quote, no resident shall be denied readmission or admission to a nursing home solely based on a confirmed or suspected diagnosis of CV. Nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for CV prior to admission or readmission. Protecting the rights of some of society's most vulnerable members, including elderly nursing home residents, is one of the country's most important obligations, said Assistant Attorney General for Civil Rights Division Eric Drebend. We must ensure they are adequately cared for with dignity and respect and not unnecessarily put at risk. According to the Centers for Disease Control, New York has the highest number of CV deaths in the United States, with 32,592 victims, many of them elderly. New York's death rate by population is the second highest in the country, with 1,680 deaths per million people. New Jersey's death rate by population is 1,733 deaths per million people, the highest in the nation. In contrast, Texas's death rate by population is 380 deaths per million people, and Texas has just over 11,000 deaths, though its population is 50% larger than New York and has many more recorded cases of CV. 577,537 cases in Texas versus 430,885 cases in New York. Florida's CV death rate is 480 deaths per million, with total deaths of 10,325, and a population slightly larger than New York. And these are the statistics that we've been talking about on this channel that it was going to be impossible for the governors to run from forever. The Department of Justice's Civil Rights Division is evaluating whether to initiate investigations under the Federal Civil Rights of Institutionalized Persons Act, which protects the civil rights of persons in state-run nursing homes, among others. The Civil Rights Division seeks to determine if the state orders requiring admission of CV patients to nursing homes is responsible for the deaths of nursing home residents. On March 3, 2020, the Attorney General announced the Justice Department's National Nursing Home Initiative. This is a comprehensive effort by the department led by the Elder Justice Initiative and in strong partnership with the U.S. Department of Health and Human Services that uses every available tool to pursue nursing homes that have provided substandard care to their residents. As announced on April 10, 2020, the department is also investigating the Soldiers' Home in Holyoke, Massachusetts, where CV has taken the lives of at least 76 residents. The data requests and Soldiers' Home investigation are not accusations of fault nor wrongdoing by the states or any other individual or entity, and the department has not reached any conclusions about these matters. And I think it best we read at least one of the letters, although they're separate letters for each governor. I'll provide the link in the description where you could go read them yourselves. Dear Governor Cuomo, I write to request information regarding CV and nursing homes run by or for the state of New York as defined in more detail hereafter. The Civil Rights Division of the Department of Justice enforces the Civil Rights of Institutionalized Persons Act. The division is evaluating whether to open a CRIPA investigation of institutions, quote, providing skilled nursing, intermediate or long-term care or custodial or residential care that are, quote, owned, operated, or managed by or provide services on the behalf of New York or a political subdivision of New York. To help us make this determination, the division respectfully requests the following documents and information for each public nursing home. Data should be provided on a public nursing home specific basis for each public nursing home in the state. Number 1. The number of public nursing home residents, employees, other staff, guests, and visitors who contracted CV regardless of where such persons contracted CV. Number 2. The number of public nursing home residents, employees, other staff, guests, and visitors who died of CV, including those who died in a public nursing home or after being transferred to a hospital or other medical facility, hospice, home care, or any other location. 3. All state-issued guidance, directives, advisories, or executive orders regarding admission of persons to public nursing homes, including those previously superseded, as well as the dates each such document was in effect. Number 4. The number of persons who were admitted to a public nursing home for a hospital or any other facility, hospice, home care, or other location after testing positive for CV during the period the guidance or orders were in effect. We have not reached any conclusions about this matter. The division's many years of enforcing CRIPA, the good faith efforts of the state, county, or local jurisdictions working with us have enabled us to resolve many matters amicably. We request the above information within 14 days. And guys, we covered this when it happened. I covered that the specific nursing home in Washington State that was one of the first 2 infections involving the U.S., which was the Jade Princess cruise ship and the nursing home in Washington State. I covered both of those in detail as we started watching the CV come to the borders of the United States. At the time that these states moved CV patients into their nursing homes, the CDC had already done an in-depth statistical analysis of what happened at that nursing home in Washington State. That CDC directive was released prior to the governors of New York, New Jersey, Delaware, Michigan, etc., ordering CV patients moved into nursing homes. The date on the CDC memorandum that was the report from studying how horrible things went in that Washington nursing home came out a week before the documents that the governors released moving CV patients into nursing homes. In Pennsylvania, the Health and Human Services Director moved her own grandmother out of a nursing home on the same exact day that these directives were released. She was asked about it at a presser, and she said it was unrelated to the governor's order. Yeah, right. I would like to see something come from the Department of Justice regarding this. We'll keep an eye on it. Hopefully, we'll see some accountability from this in the months and years that follow. But if there's one thing we've learned about the whole situation, guys, the gears of law move slowly. Also, as a side note, I have heard rumors pushed around the rumor mill that Barr told Durham that Biden and Obama had immunity. I heard that yesterday. If that does end up being the case, I'll report it as news. I won't say this is a rumor I heard before it, and I'll report it as actual news, but it doesn't sound good as far as people who are expecting, huge prosecutions out of the Durham investigation. I hope that there is at least the ability to charge somebody who headed an agency. Brennan, McCabe, Comey, someone. But at this point, all I can do is hope. But anyways, guys, like, share, sub the channel. I'll keep you apprised of what this is going on and other news that I see. In the meantime, I'll talk to you guys later. Out.